What is acoustic reflex in tympanometry, and why is it tested? Imagine your middle ear muscles as tiny guardians that respond automatically to loud sounds. That's essentially what the acoustic reflex is. When you hear a loud noise, a small muscle called the stapedius contracts involuntarily. This contraction stiffens the tiny bones in your middle ear, which helps protect your inner ear from potential damage caused by loud sounds. Tympanometry is a test that measures how well your middle ear is functioning by checking how your eardrum moves in response to changes in air pressure. When combined with acoustic reflex testing, it gives a fuller picture of your hearing health. During this test, a small probe is placed in your ear canal. The device changes the air pressure and measures how your eardrum responds. Then, a loud sound is played into your ear to see if your stapedius muscle contracts. If it does, the tympanometer detects a change in the movement of your eardrum and records the lowest sound level that causes this muscle to react, called the acoustic reflex threshold. So, why do healthcare providers test the acoustic reflex? First, it helps diagnose problems in your middle ear or in the neural pathways involved in hearing. Because the reflex involves nerves and parts of your brainstem, an abnormal or absent reflex can point to issues like nerve damage, inner ear problems, or facial nerve dysfunction. It's a way to look beyond just hearing sensitivity and check the health of the entire auditory pathway. Second, it helps differentiate between different types of hearing loss. If the reflex is absent or requires very loud sounds to trigger, it might mean there's a problem in the inner ear or along the nerve pathways, rather than just in the outer or middle ear. This can be especially useful in figuring out if hearing loss is conductive, caused by issues like fluid buildup or a perforated eardrum, or sensorineural, involving the inner ear or nerves. Third, acoustic reflex testing can reveal middle ear problems such as fluid behind the eardrum perforations, or ossicular chain issues. These conditions can interfere with sound transmission and affect hearing. The test is particularly helpful for children, who often experience middle ear infections, as it can detect these issues early. Finally, for those considering hearing aids or cochlear implants, knowing the status of the acoustic reflex can help audiologists plan the best treatment. It provides insight into how responsive your auditory system is, which influences device fitting and programming. The test itself is straightforward. A small probe with a speaker and microphone is gently placed in your ear canal. The device then changes the air pressure and measures how your eardrum moves. Loud sounds are played into your ear to trigger the reflex, which can be measured in the same ear or the opposite ear. The lowest level of sound that causes the muscle to contract is noted as the reflex threshold. It's worth noting that about 5% of adults may naturally lack an acoustic reflex, and if the facial nerve is damaged or paralyzed, the reflex might not occur. Remember, this test does not measure how well you hear but provides important information about your middle ear and nerve function. In summary, the acoustic reflex in tympanometry is a vital tool that helps audiologists assess how your middle ear muscles respond to loud sounds. It helps identify middle ear problems, differentiate types of hearing loss, and evaluate nerve pathway integrity. Always consult with a healthcare professional for a comprehensive hearing assessment and personalized advice.